Assalamualaikum and hi, my name is Fatina and this is our video about diuretics and their types. Firstly, what is diuretic? Diuretics are substances that increase urine production. They are mostly indicated for primary or essentially hypertension. When more urine is excreted, it will increase sodium loss and also increase water loss. Reducing the blood volume will reduce the blood pressure. It is also used to treat edema, which can be pulmonary or systemic. As the diuretics change body fluids and electrolytes, it is also can treat glaucoma and electrolytes imbalance. Sodium and water are filtered in the glomerulus capsule of nephron, then reabsorbed back to the blood at various sites along the renal tubule. Different class of diuretics prevent sodium reabsorption, causing increase of sodium loss at different sites and different mechanism. There are 5 different diuretics, including carbonic anhydrase inhibitors, osmotic diuretic, Luke diuretics, potassium-sparing diuretics, and thiazide diuretics. Firstly is carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors inhibit the enzyme carbonic anhydrase, which is required for reabsorption of bicarbonate in proximal tubule. This leads to greater sodium loss in the form of sodium carbonate and at the same time greater water loss in the form of urine. However, these inhibitors have the weakest diuretic effect because most of sodium loss at this early stage will be reclaimed further at different parts of renal tubule. When more sodium delivered to collecting duct, more sodium will be reabsorbed at this site through epithelial sodium channels to compensate a greater potassium loss, which may cause hypokalemia. Besides, because more carbonate loss, it will affect the acid-base balance, which will causing metabolic acidosis. Therefore, these diuretics are rarely prescribed for cardiovascular disease, and usually they are mainly used to treat glaucoma. Examples of these diuretics are include acetazolamide, diclofenac, and metazolamide.
Okay, hi, Assalamualaikum. So now we proceed to the diuretics. So we will be focusing on osmotic diuretic and loop diuretic. So what are the types of diuretics available? They are osmotic diuretic and loop diuretics. Osmotic diuretic is a type of diuretic that inhibits reabsorption of water and sodium. Loop diuretics are diuretics that act on the sodium-potassium chlorine cotransporter along the thick ascending limb of the loop of Henle in nephrons of the kidneys. That just some brief explanation about the osmotic and diuretics. Okay, osmotic diuretics. Examples are mannitol and isosorbide. So, what osmotic diuretic helps the body? How it helps the body? It opposes the action of ADH in the collecting tubule, prevents the normal absorption of water by interposing a countervailing osmotic force. As a result, urine volume increases. And also, it reduces intracranial pressure and to prompt removal of renal toxins. Where are osmotic diuretics act? Site of action involved proximal convoluted tubule and descending limb of the loop of Henle. Loop diuretics. Loop diuretics compared to the thiazide. Loop diuretics are more effective in patients with impaired kidney function. So it is can be used in patient with impaired kidney function instead of only the patient with healthy kidney function. For example, furosemide, bumetanide, and torsemide. For the mechanism of action, loop diuretics inhibit sodium, chloride, and potassium reabsorption. It also stimulates the release of renin, which through renin-angiotensin system increases fluid retention in the body, increase the perfusion of glomerulus, thus increasing glomerular filtration rate, or always called GFR. It also increases the production of prostaglandins, which results in vasodilation and increased blood supply to the kidney. Loop diuretics mostly along the ascending limb of the loop of Henle, proximal convoluted tubule, and glomerulus, where it increases the GFR.
Assalamualaikum and good day everyone. I am Nur Shazwina Huda and today I will present to you regarding the thiazide diuretics and potassium sparing diuretics. Okay, so for thiazide diuretics, there are few examples of them which are chlorothalidone, chlorothiazide and hydrochlorothiazide. Thiazide diuretics mainly acts on the distal tubule and there are few functions of them. The first one is to inhibit the sodium or chloride co-transporter, and then they also reabsorbs 5% of sodium load. And thiazide diuretics also have vasodilation effects, and they are also used as the first line drugs for uncomplicated hypertension and heart failure prevention. Next is the thiazide diuretics mechanism of action. So firstly, thiazide diuretics will reduce calcium loss in the urine to prevent the formation of new calcium kidney stones. And then it will lead to lower intracellular sodium induced by thiazides, which will result in higher calcium reabsorptions that is mediated by sodium and calcium exchanger, which is located at the basolateral membrane. Next is the side effects of thiazide diuretics. There are three of them, which the first one is hypokalemia. It occurs when the amount of potassium in the blood is too low. And the second one is metabolic alkalosis. It occurs when the body's pH is elevated to greater than 7.45. And the third one is hyperuricemia. It occurs when the uric acid level is elevated in the blood. Next, we'll move on to the potassium sparing diuretics. There are a few examples of them, which are spironolactone, epilerinone, amiloride, and triamterene. So potassium sparing diuretics mainly acts on the collecting ducts, and they are aldosterone receptor antagonists and direct epithelial sodium channel inhibitors. They act by directly inhibit the sodium and potassium pump in order to reduce the potassium loss. The reason why they are called potassium sparing diuretics is because they do not increase potassium loss, not like other diuretics did. And potassium sparing diuretics only have mild diuretics effect. Next, we'll move on to the potassium sparing diuretics mechanism of action. So firstly, sodium reabsorption occurs through the epithelial sodium channels. Meanwhile, the sodium and potassium pump are in charge for the exchange of potassium loss. So the potassium influx into the cells will lead to the negative lumen potential, and this will result in reabsorption of chloride and excretion of potassium and hydrogen. Next is the side effects of potassium sparing diuretics. There are also three of them, which the first one is hypokalemia. It occurs when the amount of potassium in the blood is too low. Meanwhile, the second one is metabolic acidosis. It occurs when the body fluids contain too much acid. And the third one is gynecomastia. It occurs when there are increase in the amount of breast gland tissue in boys or men, which is caused by an imbalance of the hormones estrogen and testosterone. So that is all from me. Thank you.